fascinating is our sensory organ we have. It can serve as a reproductive organ and also a sexual organ, right? It changes throughout our life. It depends highly on hormonal influence, okay? It changes through puberty, pregnancy, breastfeeding, menopause, or even when you're seeing your period. Today, I would like to talk about 8 signs you shouldn't just ignore when you notice them in your breast. Good day, everyone. Welcome back again to Healthy Lifestyle Platform. My name is Chidima Okafo. I'm a registered nurse midwife. I just like talking about our health. I'm so obsessed with reproductive health and sexuality. So today, I would like to talk about 8 signs you should not ignore. 8 signs you shouldn't ignore when you notice them in your breast. Okay, one is inverted nipple. When your nipple begin to pull inwards, when your nipple begin to pull inwards to appear like a horizontal crease, and especially if it's very new to you, you are not known to have inverted nipple all your life, and you suddenly begin to see inverted nipple or that horizontal crease in your nipple, report to hospital, please. It might be a sign of underlying issues. It might be a sign of mastitis, breast cancer, or any other issue. Report, please. Another thing you might notice still on your breast is what we call flaky rash. There might be a flaky rash around your nipple. It may appear red, sore, or even have some cracks, right? Sometimes it might even extend to the parts of the breast, okay? And if you look closer, it will look like an eczema. Please report, okay? It may be a sign of underlying issue coming up in your breast. Don't just keep quiet. Flaky rash should be examined by a doctor. Another thing you might notice still on the nipple is discharge, which might be green, might be, just white, might be a milky discharge, might be a pulsy discharge, might be a bloody discharge, it may be gray, it may be any color. Sometimes it might be spontaneous. Whenever you remove your bra, you're going to see the charge on your bra. Or it may be triggered by something, maybe by a touch or a squeeze. Just report, please, okay? Report any discharge should be examined, especially if you are not breastfeeding your baby and you are not pregnant. You should report any discharge noticed in your breast. Another thing that must be reported is when you notice tendering of the breast tissue. Is a situation whereby the breast tissue will begin to pull itself, the skin of your breast will begin to pull itself to one side. You might notice this sign very clearly when you keep your hands up. You notice that some part of the breast is not really responding, right, to that pull, right? They will just get contracted one side. We call it tethering. So report any sign of tethering in your breast, okay? It may just be okay for you, but report, let it be examined by a professional. You can also notice what we call redness, heat, inflammation, pain. Sometimes whenever you touch your breast, it's so sore, right? There is redness there is rashes there. It may be a sign of inflammation. We have mastitis, inflammation of the breast. So report any redness, any heat, any pain should be examined, please. Then there might be dimpling, right, in your breast tissue or on the skin of your breast. Whenever you look at your breast, it will look like an orange skin. There will be multiple dips here and there. We call it dimpling. So if you notice that this skin is not smooth anymore, the skin of the breast is not smooth, it has multiple dips, report for proper examination. All right, it must be examined by a doctor, at least a midwife, please. Then, if you also notice that there is breast rump, maybe on palpation, when you palpate, when you massage, you notice that there is a breast rump somewhere, right? It might be stationary, it may just be static, it might be mobile, it may just be immobile, it may be very soft, it may just be hard, it may just be firm, no matter the consistency. We need to examine it, right? It needs to be examined. Report, please. Then some people will notice that, remarkable differences in the size. I know that most people breasts are not equal, right? I know that, but you know what what is normal with you, right? So you'll be able to know when there is problem. So if you notice that there is a remarkable difference in the size of your breast, right, don't keep quiet. It may be a sign that something is developing somewhere, right? Report, please. Okay? Uneven size, asymmetrical size may be a sign of breast, disease, mastitis, breast cancer developing somewhere in your breast. So it must be examined. Please don't keep quiet. So how can you notice all these signs? Of course, you have to do something to notice them, and that is what we call breast self-examination. Is just a way of examining your breast by yourself to notice any changes in any form, in the color, in the shape, in the size, in any form, in the consistency. You need to do breast self-examination to detect all these signs, right? It should be done every month, okay? And make sure you're not doing it when you are ovulating or when you are about to see your period, because there will be a lot of mistalk with the signs, okay? Your signs might be confusing, right? Because of the hormonal influence during that period. Make sure you do it when you are not menstruating or when you are not ovulating, so you can be able to say, this is not normal with me. All right, so tell me if you need help on how to do breast self-examination. I will still do video on that if you need it. All right, thank you so much for watching. Try and share to save women from having mastitis or breast cancer. Remember, early detection is the key and prevention is better than treatment. Thank you. See you again in my next episode.